Namaskar. Breaking Myths with Dr. Abhay Kumar. He's a senior consultant oncologist and robotic surgeon at Manipal Hospitals, Kolkata. Sir, my first question to you. Now, prostate surgeries, they are very common. And right now, sir, what's your take? Does all the surgeries, enlargement of prostate, require that?
So rightly pointed out that prostate enlargement is a common issue, common problem. And as now we have a large elderly population, this common issue we face very often in our OPDs. Prostate is a small gland located in the urinary tract. So first it's very important to know what is prostate, right?
Yes.
So prostate is a small gland located just behind or below the urinary bladder. And when the age increases, the patient gets older. Because of the hormonal changes in the body, the prostate slowly starts increasing in size. As the size increases, sometimes this enlarged prostate causes obstruction in the urinary flow that the patient finds it's difficult to pass urine. All the enlarged prostates don't require treatment. Some enlarged prostates may not obstruct the urinary passage and they can be managed without any medications. Some may require some lifestyle changes, some may require some tablets, some medicines to reduce the obstruction. But some patients which do not respond to the medical treatment may require surgery. So all the enlarged prostates don't require surgery. Around 65% of patients can be managed effectively with the medicines. A small subset of patients of enlarged prostates only require surgery.
Sir, the next question to you is that the patient is old. He's not fit for the surgery. So, sir, what you will be doing as a doctor?
This is common scenario. No? The patient of the enlarged prostate is usually an elderly gentleman, and in that age, diabetes, blood pressure, the heart issues are very common. And some patients are not fit for any kind of surgical intervention, right? In these patients, we try with medical treatment, and if the patient is not responding to the medical treatment and simultaneously if he is not fit for any surgical intervention, then there are a lot of non-surgical interventions which can be done safely in these kind of patients. Like for patients who is a heart patient and is on antiplatelet blood thinners which cannot be stopped, in those patients, we can safely do some procedures. They are very good, effective newer procedures like Eurolift, like rhythm therapy, which is called hot water therapy, which can be safely done in these patients. And these are therapies which can be done in OPD settings. They don't require any hospitalization. It's a small procedure, can be done in operation theatre as a daycare or OPD procedure, and the patient can be discharged same day. So there are options available. Please discuss with your doctor. Even if the patient is not fit for surgery, he doesn't require carry a catheter or urinary bag all the time. He can have a decent life, decent quality of life and normal urine flow with minimal intervention.
Sir, as you said earlier about the water therapy, what is can you just tell us something about this water therapy that we can continue on?
Right. See, the prostate enlarges and it causes obstruction in the urinary passage. So traditionally we used to give some medicine to relax the bladder, or we used to operate by using endoscopic surgeries by electric current or laser to remove the obstructing element of the prostate. But as I said, most of the patients in elderly age are not fit for any surgical intervention. In those patients, we have some minimal invasive therapies like hot water therapy. So what we do, we pass an endoscope under local anesthesia. That is, the patient is not anesthetized or is not given any anesthetic injections. We just introduce jelly, lignocaine jelly into the urinary passage. The area becomes numb and we pass a small endoscope in the urinary passage, and through that endoscope we inject hot water bubbles. So what happens, these water vapors gradually causes necrosis of the enlarged prostate, and that prostate component gradually shrinks in size and the urinary passage opens up. So this is a very novel technique and it's available in our hospital, and it's done in a OPD basis under local anesthesia, and patients usually get discharged in the same day, and usual results are very good, and patient can get rid of catheter and can be taken off the medicines in due course of time.
Sir, previously as you said about surgery, little bit about hot water therapy. So may I know what is Eurolift? And is it available in Kolkata or in outside Kolkata?
Yeah. In the series of minimally invasive therapies for enlarged prostates, so recent additions in our armamentarium are the hot water therapy, that is the RISM, and Eurolift. So what Eurolift is basically, it's a small endoscopic procedure, that is under local anesthesia. We pass a small endoscope, and through that endoscope we put clips on the enlarged prostate, and gradually we tighten the clips so that the enlarged prostate goes away from the passage and the urinary passage opens up, so the patient passes urine in a normal way. So this is done, and it's a very good procedure for enlarged prostates, and particularly for patients who are very elderly, not fit for surgery or not fit for any anesthesia, and for patients who are on antiplatelets where we cannot stop those aspirin and clopidogrel. Similarly, for patients with younger age group patients who are sexually active, and they want to avoid the complications of surgery, in those patients we can offer this Eurolift therapy, which can preserve the sexual function and can be done in a OPD basis, in a daycare basis, without the need of any anesthesia. So this is very good technique, and it's available in our hospital. We do it regularly in our hospital, and results are also very good. So you can always ask for it or discuss with your doctor regarding the newer techniques of prostate other than the conventional TURPs and the laser surgeries.
So, as we have come to the last of our question and answer Q&A, so my last question to you, sir. Biopsy, it's a very common term altogether. But as we patients are doing the biopsy report, so is it confirmed that the patient is having cancer? And so what is biopsy? And what do you term as prostate biopsy, sir?
Sometimes in prostate enlargement cases or prostate problems, we advise biopsy. So first, biopsy is done and there is cancer. This is not the fact. We do biopsy to prove that is there any possibility of any cancer or malignancy or not. So first of all the enlarged prostates do not require biopsy. Wherever we feel that there is any possibility of any cancer, like if the PSA is on higher side, if the doctor has examined the patient and feels the prostate feels abnormal, any area in the prostate feels hard or nodular, then we may advise a biopsy. Sometimes if the PSA is high, PSA is a blood test called prostate specific antigen. So if that blood test PSA report is abnormal, or if the doctor finds that the prostate feels abnormal, like it feels hard or nodular, he may advise for a biopsy. Biopsy is again daycare procedure or OPD procedure where we place small needles in the prostate and take out samples, which is sent to the lab or pathology lab to find out how it looks. So all the biopsy are not cancers. So you have done a biopsy, that is cancer is not there. Many times you find the prostate feels abnormal or the PSA is high because of some other reasons like chronic prostatitis, that is chronic infection in the prostate. So all the biopsies are not cancers. Biopsy is done to rule out or to prove that there is cancer. Second, biopsy, next we have find that most people are afraid of the word biopsy. They feel that biopsy is done for only for cancer. Second, they feel or they have heard that if biopsy is done, the cancer will spread. So again, this is again a myth. If biopsy is done, it doesn't increases the spread of cancer. Either the cancer has already spread to other body parts, or if you don't take treatment after the biopsy, then there is possibility of the cancer spreading to other body parts. So, and biopsy is a very safe procedure. Its technique is very safe. There is very minimal chances of complications like bleeding or infection. Otherwise, it's a daycare and painless procedure, and we take small needle samples, so we don't put any cut on the body, and so there is nothing to be afraid of biopsy, and it doesn't cause increase or spread in the cancer.
As we are closing this video, thank you, sir, for your valuable time. And as we are closing with the myths which are very common and the most asked questions to the common people, and also we would be having lots of more sessions coming forward. So please watch it. Thank you.